Hello everyone, my name is Apurva Parit. Today I am going to talk about mixed dentition. Definition: the period during which both primary and permanent teeth are in a mouth together is known as a mixed dentition period. Successional teeth: those permanent teeth that follow into a place in the arch once held by primary tooth, for example incisors, canines, premolars. Accessional teeth: those permanent teeth that erupt posteriorly to the primary teeth, for example molars. There are three phases of mixed dentition: first transitional period, inter-transitional period, and second transitional period. First transitional period. It is characterized by the emergence of the first permanent molar and the exchange of primary incisors with permanent incisors. The location and the relationship of the first permanent molar depends much upon the distal surface relationship between the upper and lower second primary molars. These relationships are of three types. Flush terminal plane, in which the distal surface of the deciduous second maxillary and mandibular molar are in a straight plane. It leads to class 1, class 2 or end-to-end molar relationship. Mesial step relationship, in which the distal surface of the deciduous second mandibular molar is more mesial to that of the deciduous second maxillary molar. It leads to either class 1 or class 3 molar relationship. Distal step relationship, in which the distal surface of the deciduous second mandibular molar is more distal to that of the deciduous second maxillary molar. It leads to class 2 molar relationship. Early mesial shift. If the primary molars If the primary dentition is space dentition with the flush terminal relationship of the second primary molars, the eruptive forces of the permanent molar causes closing of any existing space between the primary molar effectively, causing decrease in arch length. Late mesial shift. When no spaces exist, the eruptive first permanent molar is not able to close the space. In these cases, when the primary molar exfoliates, the permanent molars migrate mesially to use up the leeway space. Exchange of incisors. The permanent incisors are larger than the primary teeth they replace. This difference between the amount of space needed for the accommodation of the incisors and the amount of space available for this is called as incisal liability. It is 7 mm in maxillary arch and 5 mm in mandibular arch. Objectives of overcoming incisal liability: interdental spacing of primary incisors, intercanine arch width growth, labial positioning of the permanent incisors, and favorable size ratio between primary and permanent incisors. The eruptive permanent canines displace the roots of lateral incisors mesially, resulting in the transmission of the force on the roots of central incisors, which also gets displaced mesially. A resultant distal divergence of the crowns of central incisors causes a midline spacing. This midline spacing is described by the broadband as ugly duckling stage, as the children tend to look ugly during this phase of development. Here we can see that it is a self-correcting malocclusion. It corrects itself after eruption. After the eruption of canines, the canine after eruption applies pressures on the crowns of incisors, thereby causing them to shift back to original position. Inter-transitional period. In this period, the maxillary and mandibular arches consist of sets of primary and permanent teeth, permanent incisors, primary canines and molars, and first permanent molars. Features of intertransitional period. Under the influence of tongue, the mandibular lateral incisors assume their proper position in the arch and its initial lingual location is eliminated. Small discrepancies are corrected by pressure exerted by tongue and lips. No fixed intercuspal relationship is present. This helps in the mesial drift of the mandibular teeth. Second transitional period, in which the combined mesiodistal width of the permanent canines and premolars is usually less than that of the primary canines and molar. This surplus space is called as a leeway space. The second transitional period, it is characterized by the replacement of the primary molars and canines by the premolars and the permanent canine respectively. So what is the significance of the leeway space? The leeway space is utilized by the molars to establish the class 1 molar relationship. This leeway space, it is 1.8 mm in maxilla and 3.4 mm in mandible. Features of second transitional period. Early doubling stage is corrected. Arch loses its roundness. Most common sequence of eruption is 4-3-5 in maxilla, 3-4-5 in mandible. This sequence is essentially to prevent crowding and utilization of the leeway space. The dental arch length and arch circumference decreases with mesial force. References. Thank you.